Today's story is about the Wisconsin man who lost all of his limbs to a serious infection brought on by a dog licking his leg. Still needs to undergo at least 3 more surgery. Greg Manteufel, 48, has undergone 7 surgeries since being admitted to the hospital in late June after presenting with flu-like symptoms. On Thursday, Greg's wife Dawn posted a photo of him in a hospital bed looking desolate with a blackened nose, but she assured he was in good spirits. Keep watching to find out more about his story. He lost some of his top lip, nose skin, and portions of his limbs and legs. Capnocetoviga, a germ from Ellie's mouth or another canine he came into contact with, was the root of the problem. Saliva frequently contains Capnocetoviga. Doctors can't rule out the possibility that the capnocytovic bacteria will reinfect man and the other patients, according to a theory proposed by a team of researchers affiliated with Harvard Medical School. Greg Manteufel felt he had the flu in June 2018 due to a genetic variation. He had a fever, vomiting, and diarrhea, but his family took him to the hospital when he became disoriented. Later, he revealed to the medical professionals in this August 2, 2018, file photo provided by Dawn Manteufel of Greg Manteufel lying on his hospital bed at Milwaukee's Froedtert Hospital. He suffered from capnocetovica, which caused him to lose some of his arms, legs, skin on his nose, and half of his upper lip. His wife Dawn and his 26-year-old son Mike were among the many things he had to live for. As a result, his wife and kid maintained their optimism. Learning to transfer from his wheelchair to the bed toilet, Manteufel claimed he would leave the inpatient rehabilitation facility in about 2 weeks. And according to Dr. David Del Toro, medical head of the inpatient rehab center at Froedtert, the typical stay is 3 to 4 weeks. Manteufel made equally quick improvements with his leg and prosthetic arm. According to studies, 5 previously healthy patients who had capnocetoviga were given genetic testing by the team to check if they shared any traits. They observed that each person had a genetic variation linked to an immune system gene that was functioning differently. Elizabeth Faig, a genetic counselor at Brigham and Women's Hospital. Greg's body was trained to use the stubby prosthetics before switching to the full-sized ones. They have previously removed skin from that area of his forehead. Although it currently appears enormous, it will eventually blend in with the rest of his face. Additionally, doctors informed Dawn that Greg would require considerable plastic surgery to reconstruct his nose. It's important to say that animal lovers shouldn't worry. While most people who become infected will not show any symptoms, it has been shown to cause severe illness in those who have compromised immune systems, according to a 2003 study from France. Dr. Munoz Price told the Associated Press that this infection is very rare. The bacteria can be transmitted to humans through bites, licks, or even close proximity with the animal seeping into the skin, even without a cut or scrape. Capnocetoviga canemorsis, a bacterial pathogen, is frequently found in the saliva of cats and dogs. Although it is extremely unlikely to harm healthy people, it has been known to seriously afflict those with impaired immune systems or pre-existing diseases. Bacterial transmission can happen via bites, licks, or even close proximity. Within 1 to 8 days of exposure, proximity to animal symptoms typically manifest, but generally on the 2nd day, they can range from sepsis to flu-like symptoms. Antibiotics are typically helpful in the treatment of infection and are advised for a minimum of 3 weeks, although there may be long-term negative effects, such as kidney failure and amputation due to gangrene.